From Lagos, the nation's commercial capital, this is the news at 10, live from Channels Television. Reporting tonight, Amarachi Ubani.
Good evening and welcome. Tonight, global attention targets quick control of Ebola virus disease, as experts say it will take at least 6 months to check the outbreak. Lagos State government debunks claims that Ebola patients are being neglected, insists the state has the capacity to look after them. Nigerian Medical Association demands immediate reinstatement of 16,000 sacked resident doctors, vow to continue strike action. And European Union condemns what it calls abuses and atrocities against religious minorities in Iraq.
On business news, the Central Bank of Nigeria and some financial service providers launched an alternative channel for foreign exchange transfer for small end users.
And on sports news tonight, after weeks of long wait and anticipation, the 2014-2015 English Premier League season begins this weekend.
It's also one that would not be easily forgotten, being the day Liberian-born American Patrick Sawyer landed in Nigeria. However, the global preoccupation is how to control the Ebola virus disease. But as much as a lot has been done in that respect, Doctors Without Borders is saying that it would take up to 6 months to bring the outbreak under effective control. Our health correspondent, Yomi Otaigbe, gives us an overview on the latest on the spread of the virus and containment efforts.
The outbreak of Ebola virus disease in West Africa continues to escalate as the World Health Organization puts the number of cases at 1,975, with 1,069 deaths reported from Guinea, Liberia, Sierra Leone, and Nigeria. The World Health Body says extensive contact tracing and monitoring implemented with the support from the U.S. Center for Disease Control and Prevention has kept the number of additional cases small in Nigeria. Elsewhere, the outbreak is expected to continue for some time. The medical charity Doctors Without Borders estimates that the outbreak of Ebola in West Africa would take at least 6 months to bring under control. The WHO's operational response plan extends over the next several months. Staff at the outbreak sites see evidence that the numbers of reported cases and deaths vastly underestimates the magnitude of the outbreak.
There's fear, it's normal, but that fear needs to be translated and be mobilized. Fear will keep us alert, but then we need to mobilize, and then we need to create more cooperation. Because we never faced that before, unless everybody put their effort together, it will not happen. We've said it over and over and over again, and I think it's happening. We're more or less on the same page. WHO needs to take a leadership and bring some strong element into the field that are operational.
Contact with the nurse. The experimental drug nanosilver, which was announced by the Minister of Health, Professor Onyebuchi to be used for the Ebola patients, is yet to be received by the Lagos State Ministry of Health.
On the nanosilver drug, yes, we heard on you that the thing is on the way to Lagos. We have not received delivery as of now, but let me say, I go for the evening briefing at the EOC, Emergency Operations Center. When I go there, I will get the full details. As of now, I am not aware of the drug here. Perhaps it's there, it's come. But again, we in Lagos say we are also exploring such possibilities because we sent our pharmacists to inquire properly from the 2 manufacturing companies how best to get them.
Meanwhile, officials in Liberia face a difficult choice of deciding which handful of Ebola patients will receive an experimental drug that could be life-saving. ZMapp, the untested Ebola drug, arrived in the West African country late on Wednesday. The government had earlier said 2 doctors will receive the treatment, and the Information Minister, Louis Brown, revealed that the 3rd person will probably be another healthcare worker. These are the last known doses of Zidmap left. Kenya Airways has rejected pressure to suspend its flights to the Ebola-hit states of West Africa. This is coming after the WHO, which declared a global health emergency last week, recently said the risk of transmission of Ebola during air travel remained low, as the disease is not airborne. This has been eliciting mixed reactions from the media in Kenya. As we wrap this up, a woman is being tested for the Ebola virus in Scotland after falling ill at an immigration removal centre. Health authorities have confirmed they are investigating a possible case of the deadly virus, but have said it so far appears highly unlikely the test would turn out to be positive. The woman is believed to have arrived from Sierra Leone, one of the countries most affected by the epidemic in West Africa. Yomi Otaigbe reporting for Channels Television News.
Well, across the states, a lot is being done by authorities to contain the spread of the dreaded disease. But what seems to be common in most states is efforts by the governments to enlighten people on the symptoms and preventive measures. Our correspondent, Mary Alale Yusuf, reports.
The threat posed by the Ebola virus disease, state governments across Nigeria seem to be rising to the challenge by keying into the most vital weapon, which is education. The sale of bushmeat is a source of livelihood for some Nigerians, but with the advent of the Ebola virus, many of them may have their source of livelihood taken away. The Ogun State government thought it necessary to educate these people. The state chapter of the Nigerian Medical Association has also trained about 100 health workers, but is asking the state government for safety equipment and isolation centers.
There's general panic. People are wondering, are we suspending the sale of bushmeat? Are we stopping them from selling? And I've just explained to them that's not the intention of His Excellency. We've discussed with him. We've let him realize that there's a vet angle to this whole, the spread of the virus. So we are trying to attack it from here, while the primary focus of the Ministry of Health is to stop the transmission from human to human. But as is, we need to also forestall further cases of a transmission from animals directly to human beings.
For Lagos State, it's not only about sensitizing the public. Authorities say they have the capacity to handle the disease following guidelines from the Center for Disease Control.
A 40-bed complex with male and female ward for confirmed cases, an 8-bed isolation ward upgraded to hold suspected cases, backed up by 2 emergency tents to hold additional 24 suspected cases. We have a dedicated borehole. We also have a dedicated 60 kVA generator, backed up by a 250 kVA generator for the entire complex. There is the involvement of Loma for medical waste management. We also have 2 5,000-liter septic tanks, one for each of urine and feces, decontaminated prior to evacuation.
The fear of the spread of the virus also engulfed Kwara State residents when the news of a 7-month-old baby with symptoms similar to those caused by the virus hit the airwaves. That led to this meeting, with government officials attempting to dispel the rumors.
We took samples, blood samples of the patient and the mother for diagnosis of the virus. Currently, the samples are on their way to Lagos. One of the samples will be given to Professor Tomori, who is the major viral person in Nigeria at Redeemers University. And we are dropping the second sample at Luth. As we await the test results, other measures are being put in place, such as 1, His Excellency has approved the purchase of the test machine, which has been ordered from Abuja.
The case is not different in Abia State, where the government organized a 1-day sensitization and enlightenment campaign on the Ebola disease for all civil servants in the state. This is to create more awareness of precautionary measures as well as attitudinal change.
You and I know that it's not every person that has it. So we have people who are now working in the villages to make sure that town announcers were also using the churches, to make sure that announcements are made in the churches, in the villages, to give basic information about this Ebola, what it is, and how it can be prevented.
It has been said that the Ebola virus can be avoided by access to information and not fear. It's not enough to have information only. All hands must be on deck to act on the information to keep the Ebola disease in check. Mary Alale Yusuf, Channels Television.
In part two, after the break, Boko Haram abducts over 50 residents of Durumbaga in Borno State. That's in a moment. Please join us again.